In terms of sort of, obviously there's, for patients or parents looking into braces, there's just such a wide range of different ways of straightening teeth. So do you want to sort of give your kind of, what's your favorite like system, or is that sort of a bit of a difficult question? But yeah, so what's your sort of,
It's really difficult to answer
depends on the
because I don't like to have
one size fits
a
all.
one appliance treats all patients. It is really individual. And for example, during consultation, I'll ask things like, whether the child plays sports. What kind of sports do they play? Do they play contact sports such as hockey, rugby? Do they play any instruments? Do they play woodwind, brass? Because that can impact on the kinds of appliances. And what the, even this relates to adults, what the child is like. Are they forgetful, or are they really diligent, and do they do exactly as they're told? So I would say the most popular type of appliance for the average teenager, bearing in mind I don't like to use the term average because there's no such thing as an average person or teenager, I would say it's fixed braces. They are glued to the teeth. They work all the time. They're not dependent on the child remembering to wear things such as invisible aligners. Are quite efficient. They can have colours, and it's what most teenagers have at the moment. So teenagers like what their friends have, and they work very well. My own daughter had braces, and she had metal braces because that's what she wanted, and they worked really well for her kind of bite. But in terms of other appliances, the other main appliances are invisible aligners. They're very good. They work very well. They're also discreet for those that may prefer something that's less visible. They do need to be worn. The recommended wear time is about 22 hours per day. Taken out for eating, taken out for any contact sports, replaced with a mouth guard, taken out for drinking anything but water. So you can imagine in a busy, active day of the average teenager, when they've got lots of sports, lots of activities, or if they're snacking a lot, that would mean that the aligners are out of the mouth quite a bit. So things like that need to be taken into account. But they work very well for some teens, very well. And then the other option is a more aesthetic version of the fixed braces. So they also come in ceramic. It makes them less noticeable, and you have less of a metallic look.